No more stroke. What is a stroke? A stroke occurs when a blood vessel becomes blocked or ruptured, causing a sudden interruption or severe reduction in blood flow to a part of the brain. A stroke causes brain cells to die and can lead to permanent damage or disability, depending on the area of the brain affected. Stroke is often thought of as a disease that affects older people. However, it can happen to anyone at any age. In Singapore, stroke is the fourth leading cause of death, accounting for 6% of all deaths in 2020. Main types of stroke. 1. Ischemic stroke. Blockage in an artery causes about 85% of all strokes. All types of ischemic stroke respond to preventive treatment. The most common types of ischemic stroke are a thrombotic stroke. A blood clot thrombus forms in an artery in the neck or brain. B. Embolic stroke. A blood clot forms somewhere else in the body, usually the heart, and blocks a blood vessel in the brain. 2. Hemorrhagic stroke. Hemorrhage is blood loss. This type of stroke is caused by a rupture in an artery in the brain or on its surface. Such a rupture may be caused by an aneurysm, a weak area in the wall of an artery, or a malformation in the brain's blood vessels. Bleeding may occur within the brain tissue or between the brain and the protective membrane outside it. About 15% of strokes are caused by hemorrhage. 3. Transient ischemic attack. TIA. A TIA, commonly known as a mini stroke, is actually a brief stroke that usually lasts only a few minutes. TIAs are caused by a temporary lack of blood flow to a specific part of the brain and do not cause noticeable lasting effects. However, it is generally thought that the risk of a stroke is higher after a TIA, so immediate medical attention is needed. Warning signs for both stroke and TIA are the same and include the following sudden or intermittent symptoms. 1. Acute numbness, weakness or paralysis of the face, arms or legs, especially on one side of the body. If you cannot lift both arms above your head at the same time or smile normally. 2. Sudden loss of balance, dizziness or loss of coordination. 3. Sudden blurring of vision, decreased vision or seeing double in one or both eyes. 4. Sudden confusion and difficulty speaking or understanding simple sentences, if you cannot repeat a simple sentence. 5. Sudden, unexplained, severe, localized headache, sometimes accompanied by vomiting. If you have more than one of these symptoms, it is more likely that you have had a stroke. But they are warning signs that a stroke has occurred or is about to occur. Every minute counts. The sooner you get treatment, ideally within 60 minutes, the better your chances of minimizing permanent damage.